Welcome to the NCLEX Practice Test for Pharmacological and Parenteral Therapies. This practice test consists of 40 questions that cover a variety of topics related to medications and their administration. Each question comes with a correct answer and detailed explanation to help you better understand the materials. If you found this video helpful, be sure to like the video and subscribe to our channel for more resources. Let's get started. 1. A nurse is preparing to administer an enema to a 64-year-old client. Which of the following actions of the nurse is most appropriate? A. Assist the client to lie in the semi-Fowler position. B. Apply lubricating jelly to the tip of the catheter before insertion. C. Instill a total of 30 cubic centimeters of fluid into the client's rectum. D. Ask the client to hold the solution in for 30 seconds. Correct answer, B. Apply lubricating jelly to the tip of the catheter before insertion. When administering an enema to a client, the nurse should place the client in the Sims position for easy access. Lubricating the tip of the catheter, the nurse should instill a maximum of 750 to 1000 cubic centimeters of fluid for an adult client. Following administration, the nurse should ask the client to hold the solution for at least 5 minutes. 2. Which of the following is a fat-soluble vitamin? A. Vitamin C. B. Vitamin D. C. Vitamin B6. D. Riboflavin. Correct answer, B. Vitamin D. Fat-soluble vitamins are those that can be stored within the body. If a person takes in more than necessary, excess amounts can be stored to be used for later. Although this may be beneficial to avoid vitamin deficiencies, fat-soluble vitamin toxicities may also occur. Fat-soluble vitamins are vitamins A, E, D, and K. 3. A nurse is preparing to administer an enteral feeding through a gastrostomy tube. Before administering the feeding, the nurse aspirates some stomach contents and checks the pH. The result is 3.9. What is the next action of the nurse? A. Administer the feeding as ordered. B. Pull the feeding tube out approximately 3 centimeters. C. Flush the feeding tube with 60 cubic centimeters of water. D. Contact the physician. Correct answer, A. Administer the feeding as ordered. Checking the pH before administering an enteral feeding verifies placement that the gastrostomy tube is in the correct position. A pH of 4 or less indicates that the tube is in the stomach and the nurse may continue with the internal feeding. 4. How many cc's are there in 25 ounces? A. 250. B. 500. C. 750. D. 1000. Correct answer, C. 750. There are 30 cubic centimeters per ounce. There are 750 cubic centimeters in 25 ounces. 5. Your patient has finished a 12-ounce can of iced tea and 8 ounces of fresh orange juice. What will you record on the intake and output form for this patient's intake? A. 20 cubic centimeters. B. 20 centimeters. C. 600 cubic centimeters. D. 600 centimeters. Correct answer, C. 600 cubic centimeters. You will record 600 cubic centimeters of fluid intake. There are 600 cubic centimeters in 20 ounces, 8 plus 12 is equal to 20, of fluid intake. 6. Your patient ate an 8-ounce cup of Italian ice. How much will you record on the patient's intake and output form in terms of this patient's fluid intake? A. 240 cubic centimeters. B. 120 cubic centimeters. C. 8 cubic centimeters. D. 0 cubic centimeters because Italian ice is not a fluid. Correct answer, A. 240 cubic centimeters. You will record 240 cubic centimeters of fluid intake. Italian ice is considered a fluid. 7. Which of the following bony landmarks is described by large, blunt, irregularly shaped process, such as that found on the lateral aspect of the proximal femur? A. Tubercle. B. Tuberosity. C. Condyle. D. Trochanter. Correct answer, D. Trochanter. The greater trochanter is found on the lateral aspect of the proximal femur and is a bony process that is large. This process forms the attachment site for many muscles of the legs. 8. A patient who is blood type AB. A. Can receive plasma from a type B donor. B. Can receive whole blood from a type A donor. C. Can receive packed RBCs from a type O donor. D. All of the above. Correct answer, C. Can receive packed RBCs from a type O donor. A patient who has blood type AB has AB antigens on his red blood cells. A donor that has antibodies to AB antigens cannot donate plasma to an AB patient. Of the above listed answers, only an O-type donor can donate to this patient, as O donors have no antibody-stimulating antigens and no donated antibodies since the donation was packed with red blood cells. 9. To properly read a meniscus. A. Hold the measuring device at eye level and read the bottom of the curve of the liquid level. B. Hold the measuring device at eye level and read the top of the curve of the liquid level where the liquid holds to the walls of the container. C. Hold the measuring device at table level and looking down into the measuring device, read the bottom of the curve of the liquid level. D. Hold the measuring device at table level and looking down into the measuring device, read the top of the curve of the liquid level. Correct answer, A. Hold the measuring device at eye level and read the bottom of the curve of the liquid level. To accurately measure liquids that are in containers, hold the container at eye level and read the volume at the bottom of the meniscus. 10. A physician has written an order for 2.0 mg MSQ 2 to 4-hour PRN pain. What is the nurse's response to this order? A. Give 2 mg of morphine sulfate to the client. B. Give 20 mg of morphine sulfate to the client. C. Contact the pharmacy to clarify the order. D. Contact the physician to rewrite the order. Correct answer, D. Contact the physician to rewrite the order. This order has errors that could potentially result in harm to the client if not followed correctly. The use of 2.0 involves a trailing decimal point, which can cause confusion as to the dose of the drug. The abbreviation MS is one of the Joint Commission's do not use abbreviations, as this could mean morphine sulfate or magnesium sulfate. Although the order states the drug should be used for pain, the nurse should clarify with the physician as to the exact dose and drug to be used. 11. A nurse is preparing to draw a blood specimen from an adult client's central line. All of the following actions for this procedure are correct except A. Disconnect the current infusion. B. Clean the cap with alcohol and attach a 5 cubic centimeters syringe. C. Draw 5 cubic centimeters of a blood sample to discard. D. Flush with saline after the sample. Correct answer, B. Clean the cap with alcohol and attach a 5 cubic centimeters syringe. When drawing a blood specimen from a central line, the nurse should disconnect any infusions that are currently running and that could contaminate the specimen. The nurse should always use a minimum size of a 10 cubic centimeter syringe when using a central line to avoid placing too much pressure on the catheter. 12. Mr. G has been admitted to the hospital with a head injury after a 12-foot fall. Which of the following nursing interventions is most appropriate when monitoring intracranial pressure? A. Administer hypotonic solutions. B. Keep the head of the bed flat. C. Increase the client's core body temperature to 99.9 degrees. D. Administer corticosteroids as ordered. Correct answer, D. Administer corticosteroids as ordered. Corticosteroids may be used in clients at risk of increased intracranial pressure to reduce swelling of brain tissues. Corticosteroids may be used for a client suffering from a traumatic brain injury. Monitoring intracranial pressure also involves elevating the head of the bed, administering hypertonic solutions, and preventing fever in the client. 13. A nurse is caring for a 3-day-old infant who needs an exchange transfusion. Which of the following statements is appropriate for teaching the child's parents about this procedure? A. The registered nurse will be performing the procedure. B. The procedure takes approximately 1.5 hours. C. The nurse will draw out 250 cubic centimeters of blood and then immediately replace it with 250 cubic centimeters. D. The infant will continue to receive phototherapy during the procedure. Correct answer, B. The procedure takes approximately 1.5 hours. An exchange transfusion is a method of controlling high bilirubin levels in infants when traditional phototherapy is unsuccessful. During an exchange transfusion, the physician removes 5 to 10 cubic centimeters of blood and then replaces it with donor blood. The parents of this infant should know that the procedure is always performed by a physician and will take approximately 1.5 hours to complete. 14. The OR nursing staff are preparing a client for a surgical procedure. The anesthesiologist has given the client medications and the client has entered the induction stage of anesthesia. The nursing staff can expect which of the following symptoms and activities from the client during this time? A. Irregular breathing patterns. B. Minimal heartbeat, dilated pupils. C. Relaxed muscles, regular breathing, constricted pupils. D. Euphoria, drowsiness, dizziness. Correct answer, D. Euphoria, drowsiness, dizziness. During the induction stage of anesthesia, the client may appear euphoric, drowsy, or dizzy. The anesthesiologist is just beginning to administer medications during this stage. The induction stage ends when the client loses consciousness. 15. A physician has administered ketamine to a client who is preparing to undergo general anesthesia. Which of the following side effects should the nurse monitor for this client? A. Delirium. B. Muscle rigidity. C. Hypotension. D. Pinpoint rash. Correct answer, A. Delirium. Ketamine is a type of anesthetic that produces dissociation and lack of awareness for a client. It may be used prior to general anesthesia or as part of sedation for a short procedure. Ketamine may cause side effects of delirium, hallucinations, hypertension, and respiratory depression. 16. A client is undergoing radiation therapy for treatment of thyroid cancer. Following the radiation, the client develops xerostomia. Which of the following best describes this condition? A. Cracks in the corners of the mouth. B. Peeling skin from the tongue and gums. C. Increased dental caries. D. Dry mouth. Correct answer, D. Dry mouth. Xerostomia is another name for dry mouth, a condition that may occur among clients who are undergoing radiation therapy, particularly in the head and neck regions. Xerostomia may occur if the salivary glands are damaged during therapy, decreasing the client's abilities to wet his mouth. 17. A nurse is caring for a patient on the burn unit who has burns on 80% of his body. The doctor placed an order to begin total parenteral nutrition, TPN, today at 0600. On assessment, the patient has a left antecubital peripheral 4 and a right peripherally inserted central line, PACC. The nurse is able to flush the peripheral 4, but unable to flush the PACC. What should the nurse do first? A. Call a code for the patient going into cardiac arrest. B. Administer the TPN through the peripheral 4. C. Follow unit protocol for non-patent PCC lines. D. Flush heparin through the PACC line. Correct answer, C. Follow unit protocol for non-patent PCC lines. A nurse must follow the protocol of the unit for non-patient PCC lines. Some facilities have a specialized nurse who unclogs central lines, or some nurses may be trained to unclog the central line themselves. Regardless, they must follow their unit/hospital protocol for this occurrence. B is incorrect because TPN must be infused through a central line. D is incorrect because a nurse must have an order to administer heparin through N4 unless it is specified in the unit protocol. 18. A nurse is providing care for a 77-year-old, white, male patient who was started on TPN today at 0600. The infusing rate is at 83.3 milliliters per hour. The patient was admitted to the hospital 2 weeks ago for adult failure to thrive. At 0700, the patient is alert and oriented X3, pleasant and cooperative. He is frail, withdrawn, tachycardic, but otherwise normal on physical assessment. The nurse enters the patient's room at 0900 and the patient is complaining of blurred vision and a headache. This change is most likely due to A. Stroke, B. Hypoglycemia, C. Hyperglycemia, D. Old age. Correct answer, C. Hyperglycemia. In the first 24 hours following initiation of TPN, a patient's capillary glucose must be taken every 4 to 6 hours to monitor for hyperglycemia. Hyperglycemia often occurs until the pancreas can increase its endogenous production of insulin. Administration of insulin is often needed to correct this complication. 19. A nurse is caring for a client who has undergone radiation therapy. The skin on her chest and abdomen itches and is red. The client complains of burning pain and the skin is beginning to slough. Which nursing intervention is most appropriate for this client? A. Apply ointment to the skin to avoid moisture. B. Wash the area gently with water and pat dry. C. Use a mild antiseptic soap to wash the area and pat dry. D. Apply talcum powder to keep the skin dry. Correct answer, B. Wash the area gently with water and pat dry. Skin redness, itching, and burning are all side effects of radiation therapy. The client's skin may begin to ooze or slough. The nurse should avoid applying ointments, lotions, or powders to the skin and instead keep it clean and dry. The nurse should use plain water, avoid soap, and pat the area dry. 20. A nurse is caring for a client who is post-op day number 1 after a total hip replacement. Although the client was alert with a normal effect in the morning, by lunchtime, the nurse notes the client is confused, has slurred speech and is having trouble with her balance. Her blood glucose level is 48 mg per dl. What is the next action of the nurse? A. Contact the physician immediately. B. Administer a bolus of 50 cubic centimeters of D20W through the 4. C. Administer 10 units of regular insulin. D. Give the client 6 ounces of orange juice. Correct answer, D. Give the client 6 ounces of orange juice. A client with a blood glucose level of 48 mg per dl is experiencing significant hypoglycemia, as manifested by confusion, balance difficulties, and slurred speech. The nurse should work to correct this situation as rapidly as possible. The first measure that can be performed quickly and will have fast results is to give the client something to eat or drink that contains glucose, such as 6 ounces of orange juice. 21. A nurse has just started a transfusion of packed red blood cells that a physician ordered for a client. Which of the following signs may indicate a transfusion reaction? A. The client suddenly complains of back pain and has chills. B. The client develops dependent edema in the extremities. C. The client has a seizure. D. The client's heart rate drops to 60 bpm. Correct answer, A. The client suddenly complains of back pain and has chills. Signs of a transfusion reaction include back pain, chills, dizziness, increased temperature, and blood in the urine. The nurse should be aware of symptoms of a transfusion reaction anytime blood products are administered and watch closely for changes in the client's health status. 22. Which of the following constitutes the 5 rights of medication administration? A. Right client, right nurse, right time, right dose, right route. B. Right client, right time, right dose, right route, right order. C. Right client, right drug, right dose, right time, right route. D. Right physician, right nurse, right client, right drug, right dose. Correct answer: C. Right client, right drug, right dose, right time, right route. The nurse must confirm the 5 rights of medication administration when giving any drug to a client. The medication must be for the right client as prescribed, it must be the correct drug at the prescribed dose, and it must be given at the prescribed route at the designated time. 23. A nurse is caring for a client following surgery when he begins to complain of pain in his right hand. The client's fore is in this hand and the skin around the site is slightly reddened and cool to the touch. The fore drip rate has slowed considerably. The client states his pain is localized to the right hand and fingers. Which situation is most likely the cause of this client's pain? A. The client is experiencing phlebitis from the last drug administered. B. The client has a blood clot developing in the distal arteries of the wrist. C. The client's pain is associated with myocardial ischemia and he is having a heart attack. D. The client's fore is infiltrated. Correct answer: D. The client's fore is infiltrated. Pain, cool skin, and edema at an fore injection site indicate fore infiltration. In this case, the slowing of the fore fluid drip rate supports the fact that the client's fore is most likely infiltrating into the surrounding tissues. Unresolved fore infiltration can lead to extensive tissue damage and disfigurement when medications and fluids enter the space surrounding the vein. 24. A client is receiving high-dose brachytherapy as a form of cancer treatment. What type of teaching must the nurse include when educating this client about safety? A. The client must remain in isolation under airborne precautions. B. The client should stay in a private room at the hospital. C. The client may need to limit visits from friends and family. D. Both B and C. Correct answer: D. Both B and C. A client who receives high-dose brachytherapy has had a radiation implant placed in his body for the treatment of cancer. Because the implant may give off radiation, the client should be placed in a private hospital room to avoid exposing the radiation to a roommate. Additionally, friends and family may need to limit visits to avoid overexposure to radiation while the client is receiving treatment. 25. A nurse is giving a client information about his new prescription for warfarin. The nurse should remember to tell the client: A. He should have his white blood cell count tested once a month. B. He should avoid any activities that could lead to injury. C. He should avoid eating leafy green vegetables. D. Both A and B. Correct answer: B. He should avoid any activities that could lead to injury. Warfarin is a drug that prevents blood from clotting, putting the client who takes this medication at risk of bleeding from injuries. The client should be instructed to limit activities that could cause injury, leading to potentially uncontrolled bleeding as a result. 26. Which of the following medications would not be an appropriate PRN medication for use during an episode of aggression or violence for the patient with a psychiatric diagnosis? A. Olanzapine. B. Meperidine. C. Ziprasidone. D. Haloperidol. Correct answer: B. Meperidine. Meperidine is an opioid used to treat pain, and is not an appropriate medication to use to treat aggressive or violent behavior. Second-generation antipsychotic medications such as olanzapine and ziprasidone, as well as traditional antipsychotics such as haloperidol, are effective agents, with or without the concurrent use of a benzodiazepine. 27. A drug form in which medication particles are instilled into a liquid and combined through agitation of the solution is called A. Suspension. B. Elixir. C. Syrup. D. Tincture. Correct answer: A. Suspension. A suspension is a type of medicine that combines medication particles with a liquid solution. When not administered, medication particles within the suspension may settle to the bottom, requiring the nurse to shake the solution to mix. Suspensions are typically given as oral solutions. 28. Following a dose of medication, a client develops inflamed mucous membranes and nasal discharge. What type of minor reaction is this client experiencing? A. Urticaria. B. Pruritus. C. Hives. D. Rhinitis. Correct answer, D. Rhinitis. Rhinitis may occur as a mild reaction following some types of medication administration. Rhinitis involves itchy or inflamed mucous membranes, particularly around the eyes, nose, and mouth. The client may also develop swelling of the nasal passages or clear discharge. 29. Mr. Y is receiving medication through a catheter that has been placed into the subarachnoid space of his spinal column. What route of medication administration is this called? A. Intrapleural. B. Intraosseous. C. Intrathecal. D. Intraperitoneal. Correct answer, C. Intrathecal. Medications administered through the intrathecal route are given through a catheter that has been placed into the subarachnoid space of the spinal column. These medications are given into cerebrospinal fluid, often for pain control. Placement of an intrathecal catheter is typically done by a trained physician or advanced practice nurse. 30. A client is having difficulties swallowing a large tablet of medication. Which of the following interventions from the nurse may best assist this client? A. Help the client to lie down while taking the medication. B. Obtain an order to give the medication intravenously instead. C. Dissolve the tablet in a glass of pineapple juice. D. Assist the client to drink a full glass of water when taking the tablet. Correct answer, D. Assist the client to drink a full glass of water when taking the tablet. When a client has trouble swallowing a large tablet, the nurse can assist him by helping him to sit in an upright position and to drink a full glass of water while taking the medication. If the client still has difficulty, the nurse may ask the physician if the medication can be crushed and mixed with a soft food, such as applesauce. 31. A nurse is attempting to find the ventrogluteal muscle to administer an intramuscular medication. In which method does the nurse find this site? A. The nurse places her palm on the client's hip at the level of the greater trochanter, pointing the thumb toward the client's groin and administering the injection between the first and second fingers. B. The nurse measures 2 finger widths below the acromion process and administers the injection at this point. C. The nurse estimates the upper and outer quadrant of the buttock and gives the injection 3 inches below the iliac crest. D. The nurse grasps the muscle of the upper thigh and administers the injection 6 inches above the knee. Correct answer, A. The nurse places her palm on the client's hip at the level of the greater trochanter, pointing the thumb toward the client's groin and administering the injection between the first and second fingers. The ventrogluteal muscle is a location for an intramuscular injection that can be found by placing a palm on the client's hip. The index finger should point toward the anterior iliac spine, while the thumb should point toward the client's groin. The nurse administers the injection between the first and second fingers in this position. 32. A nurse is administering total parenteral nutrition for a client. The solution contains 12% dextrose and 5% amino acids. Which of the following sites is most appropriate to administer this solution? F. Left radial arterial line. B. Right subclavian catheter. C. Left peripheral intravenous catheter. D. Both A and C. Correct answer, B. Right subclavian catheter. When administering total parenteral nutrition solutions, a mixture that contains greater than 10% dextrose should be given through a central line to reduce the incidence of blood clot formation. A subclavian line is a type of central line that is large enough to receive this type of fluid. 33. Mr. S is complaining of pain following a surgical procedure. The nurse checks his orders and finds that he has an order for meperidine 25 mg per 4 hours for shivering. What is the next action of the nurse? A. Give 25 milligrams of the medication and use it for pain. B. Contact the pharmacy to clarify the purpose of the medication. C. Check the medication record for other PRN pain medications. D. Administer 12.5 milligrams of the medication and document that the client was shivering. Correct answer: C. Check the medication record for other PRN pain medications. When administering medications on a PRN basis, the nurse must give the medication according to its indications and in the time allotted. If a medication is ordered for symptoms other than what the client is having, the nurse should check for other, more appropriate medications to manage the symptoms or follow the facility policy for administering the PRN drug. 34. Which of the following medications is an example of an adjuvant drug? A. Ibuprofen. B. Fentanyl. C. Hydromorphone. D. Hydroxyzine. Correct answer: D. Hydroxyzine. Hydroxyzine, Vistaril, is an example of an adjuvant drug. Adjuvants are those drugs that work with analgesics to improve pain relief. For example, a nurse may administer an adjuvant that works as a muscle relaxant in addition to a narcotic analgesic for a client who is complaining of pain and who has a lot of tension. 35. Which of the following is a potential complication of administering a dorsogluteal intramuscular injection? A. Striking the bone of the humerus with the needle. B. Inserting the needle into the sciatic nerve. C. Causing extravasation of medication into the subcutaneous tissues. D. Causing an air embolism in the superior iliac artery. Correct answer: B. Inserting the needle into the sciatic nerve. The dorsogluteal site, which is found on the upper and outer quadrant of the buttocks, may be a site for administration of intramuscular medications. However, the nurse must assess the site carefully before administration to avoid hitting the sciatic nerve that runs near this site and along the length of the leg. Inserting the needle into the sciatic nerve can cause significant nerve pain, numbness, or tingling in the buttock and the leg. 36. A nurse is preparing to administer a rectal suppository to a client. After applying gloves, checking the client's identification band, and closing the door, what is the next step of the nurse? A. Assist the client to lie in the Trendelenburg position. B. Unwrap the suppository and lubricate the end. C. Remove gloves and wash hands. D. Record the date, time, and amount of suppository to give. Correct answer: B. Unwrap the suppository and lubricate the end. Once the nurse has prepared the supplies needed to give a client a suppository, she should assist the client to lie in the Sims position, unwrap the suppository, and lubricate the end of the medication to facilitate easier insertion. Following administration, the nurse removes her gloves and documents the date, time, and amount given. 37. Mr. F has been prescribed isocarboxazid, a monoamine oxidase inhibitor, as part of treatment for depression. Which of the following foods should the nurse instruct the client to avoid while taking this drug? A. Wine. B. Sweet potatoes. C. Spinach. D. Apple juice. Correct answer: A. Wine. Monoamine oxidase inhibitors are a type of antidepressant drug that may have negative interactions with certain foods. Clients who take these drugs should be taught to avoid foods that contain tyramine, such as wine, beer, pickled foods, and some types of cheeses. Contact with these foods while taking this medication can cause severely high blood pressure. 38. A nurse is preparing to administer digoxin to a client who suffers from heart failure. What must the nurse consider before administering this medication? A. The presence of pitting edema in the lower extremities. B. The sound of rales on lung auscultation. C. The rate of the apical pulse. D. The presence of jaundiced skin. Correct answer: C. The rate of the apical pulse. Digoxin is a drug that works to increase cardiac contractility among clients who suffer from conditions such as heart failure, atrial fibrillation, or atrial flutter. Because digoxin may work to slow a rapid heart rate, the nurse should check an apical pulse before administering this medication. 39. A client has been taking his anti-anxiety medications for 4 years, even though he no longer struggles with acute anxiety. Instead, he has a routine of taking the medication each evening and feels better knowing that he has taken it. Which of the following best describes this action? A. Physiologic need. B. Physiologic dependence. C. Drug abuse. D. Drug habituation. Correct answer, D. Drug habituation. Drug habituation is a mild form of dependence on a certain type of drug that occurs when a user takes the drug out of habit. The client may not need to take his anti-anxiety medications on a daily basis, but he has formed a habit for the drug and feels better after using it. Drug habituation may be detrimental to a client if he no longer truly needs to take the drug but uses it anyway. 40. Which of the following is a disadvantage of taking medication through an oral route? A. The drug may be absorbed too rapidly. B. The drug may have a bad taste. C. The drug is more expensive to use. D. Both A and B. Correct answer, B. The drug may have a bad taste. Medications that are administered orally may have an unpleasant taste, making them difficult to take or swallow for some clients. While oral medications are often convenient and cost-effective, they may not be used for clients who cannot swallow, those who are unconscious, or those with nausea or vomiting. Congratulations! You have completed the test. Don't forget to like this video and subscribe to our channels for more resources.